Hekima podcast, funded by EP3, Wellcome Trust, Uganda Society of Health Scientists, the Department of Psychiatry at Makerere University, and we are all about helping the public understand what is mental health research. I know that many of you have seen articles in the newspapers, without mentioning the specific newspapers, which say that 14 million Ugandans are mentally sick. There was another article that came out and said by 2030, almost every Ugandan will be mad, quote unquote. Why do we need mental health research in the first place?
So the reason we do research is, one, to try out alternative therapies, alternative systems, to see what impact they're going to have on these patients. The whole point is to improve patient care and outcomes.
With misinformation in health, people can decide not to take up the treatment or services because they have been told there is an alternative. And that is more appealing than them coming for the correct treatment. And so that can lead to complications.
I will begin by addressing the part of should we fear to be involved in research? And the simple answer to that is no, we shouldn't fear to get involved in research.
If they said that 14 million Ugandans are going to be mentally sick maybe in 2030, where do you think the public would get the credible information or results or research findings that we can share with them or they should know about?
Lucky for the public, this platform is going to be a very good source of information. So before you digest information, you have to see how credible is your source of information. So
Hekima podcast is very credible by the members. It's very, very credible. You can't have such funders and you think it's not. So please share to your loved ones. Share.